Good evening and welcome to the NYC Health and Hospitals Fiscal Year 2025 Annual Public Meeting for the Borough of the Bronx. Before we start the formal program, I would like to call to your attention that we have interpretation services. If you require these services, please call 212-788-3359, 212-788-3359. And the services are in Spanish. Servicio en español. My name is Jose Pagan. I'm chair of the NYC Health and Hospitals Board of Directors. I want to thank you for joining us and would like to introduce the other board members who are here tonight. Sally Hernandez Piñero, Jackie Rowe Adams, and Dr. Mitchell Katz, our President and CEO. Also on the panel are Andrea Cohen, Senior Vice President and General Counsel and moderator for the evening, and Colicia Hercules, Secretary of the Corporation. I would like to acknowledge June Soto, Director of Community Affairs, representing New York State Senator Jose Serrano from the 29th District, participating in a listening capacity. So on behalf of the board, I would like to extend our thanks and acknowledge our Bronx facilities leadership, Cristina Contreras at Lincoln, and Christopher Mastromano, Jacoby and North Central Bronx, Division of Jacoby, and their dedicated staff for providing exemplary service to our public health system and the people we serve. And to all of you here, thank you for your support, and we strive to provide equal access to safe, affordable, quality care to all. So now I will turn the microphone over to the President and CEO, Dr. Mitchell Katz, to continue with his remarks.
Thank you, President Pagan. I'm Dr. Mitch Katz, and I'm a practicing primary care doctor and the proud president and CEO of New York City Health and Hospitals. It's an organization with a huge heart and an amazing set of employees who do their very best to provide access and high-quality services to our patients. And I appreciate our board members who are here, the staff who organized the meeting, and the team here tonight to ensure that all of your words are captured for all of the leadership to hear, not just the board members here tonight, but all of your notes will be given to all of the members of the board. My goal has always been to expand access to high-quality care, regardless of patients' ability to pay or immigration status, and advance our mission and values. I want to highlight some of the achievements of the past year. We hired over 3,600 new union nurses since March 2023, replacing many of the agency nurses. Yeah, we agree, a very good thing. We want our own nurses. We housed over 375 of our patients through Housing for Health. All 11 of our hospitals were in the Best Hospitals 2024-25 list. All of them have achieved at least 3 honors through the American Heart Association. We continue to be a leader in LGBTQ plus care. 4 of our hospitals were ranked as high performing for uncomplicated pregnancies: Bellevue, Elmhurst, Lincoln, and Woodhall. Our lifestyle medicine programs, which I recommend for all of our employees as well as our patients, have opened new sites and now are available in all of the boroughs. Our insurance health plan, Metro Plus, continues to grow its membership. We are working hard to reduce our carbon footprint. NYC Care now has over 125,000 members. We've created new wellness rooms. Our arts and medicine program continues to beautify our hospitals. And the health system even now has a podcast called The Remedy. Here in Bronx, where we are, we want to acknowledge some of the great achievements of Jacoby and North Central Bronx. The American College of Surgeons certified Jacoby as a level 2 pediatric trauma center. It's the only accredited pediatric trauma center in the borough. Jacoby was one of only 25 hospitals verified in surgical quality and patient safety by the American College of Surgeons. The bariatric program and the primary stroke program were reaccredited. The Bronx Borough President is allocating $1 million in this year's budget for NCB to upgrade its bone density scanner. And Jacoby and NCB, in what I think of as one of the great successes of health and hospitals, is working so well together to balance patient loads so that patients do not have to wait so long. Lincoln Hospital also had a very great year, having recruited a chief executive officer, and they have been engaged in community, inviting members into the hospital as a community resource. Lincoln was listed in U.S. News and World Report as a high-performing hospital for maternity care. The hospital was recognized by Health Grades as a top 100 best hospital for prostate surgery. The primary care services were recognized by NCQA for delivering high-quality patient care. And then at our Gotham sites, Morrisania and Belvis received capital funding to enhance their infrastructures. We have a new state-of-the-art 3D mammography machine at Belvis. Morrisania has a new bone density scanner and was recognized for the Million Hearts Hypertension Control Program. And the American Heart Association has recognized two of the Gotham sites for their efforts addressing hypertension, diabetes, and cholesterol. I also want to mention, I know there are some hot issues that might come up today, and I just want to say that one of the things that pleases me most about health and hospitals is we are a group where people can come forward and say what's on their mind. There's nothing wrong with healthy debate. There's nothing wrong with people being able to express different opinions, and if they do, those opinions are welcomed. Will never be a source of retribution. So one of the issues that we've talked about at two other meetings that we think we are now, with the help of NISNA, on to being able to resolve is the issue of call-outs. I understand that now, with the help of NISNA, DC 37, which is the convening group for policies that relate to all employees, has agreed to negotiate with us, and I feel certain that in the negotiation we will come up with an agreement that will work for everybody. We always have wanted to be clear that when nurses are sick or anyone is sick, we want people to stay home. We want them to use their sick leave, but we also want to make sure that we don't have a lot of unplanned call-outs because of how it affects the nurses who are left taking care of the patients. And we need to together find the right balance, and the negotiating table is the right place to do that. And now we have a path forward. So that's new since our last meeting and gives me a lot of confidence that we're going to come up with something that everybody finds agreeable. Same, I understand that we're also at a challenging point in our negotiation with our much-loved NISNA midwives at Pagney. I will tell you that I heard of a case of somebody who went way across the city just to be cared for by an NCB midwife, and how she came all the way from the far side of Queens, and she made very much the right decision, and her pregnancy was really well handled. And the question that I asked when I heard the story was, how is this woman so smart that she knew that to get the right answer, she needed to cross all of Queens and into the Bronx to go to NCB, because that's how spectacular her care is. So we know that you are without a contract. It is not a direct health and hospital contract, but we will continue to work with PAGNI to get a contract. And all contracts have to be negotiated. That's not new. I feel bad that this one is stuck, but we're going to work hard with PAGNI to get it unstuck. Yes, we love our midwives. There's no question. It has to ultimately be negotiated by the employer, which is PAGNI. But we will work with PAGNI to make that happen. We also may hear testimony today about the Just Home project, which is 58 permanent supportive apartments for patients of the Correctional Health Division whose medical needs can be met at Jacoby. The Fortune Society, which has a great track record for this kind of work. They have a brilliant program in Harlem. The neighbors love the program because of how it has been such a great part of their community. So we are looking forward to making this happen. With that, I want to proceed to the main purpose of tonight's meeting, which is to hear from all of you. And Andy Cohen, our General Counsel, will outline how the rest of the meeting will go.
Great. Thank you so much, Dr. Katz. Good evening to everyone. Before we start the program, since I saw some people coming in the last few minutes, I just want to remind you that there are language translation services available in Spanish. If you need them, call 212-788-3359. For this evening, this is the fourth in a series of 5 annual meetings that we conduct every year across the city's 5 boroughs. The purpose of these annual meetings is to inform the public on the programs and plans of New York City Health and Hospitals, as Dr. Katz just did. And now we move into the second part of the program where the board of directors, those who are present here this evening, as well as in a transcribed form, all of the members of our board of directors get to hear from the public and the community about issues of importance to all of you. All of the public testimony, everything that is spoken will be recorded. Everything that's handed in on paper will be transmitted to our full board for their consideration. We still, I think registration just closed for speakers, but we have a nice list of speakers this evening. Looks like we have about maybe just under 25 speakers or so, unless we got some ones recently. So we'll have about 25 speakers this evening. I'll be moderating, and I just want to go over a couple of quick rules. The most important, or the first one of these rules, is to say that now that Dr. Katz has spoken about New York City Health and Hospitals plans and programs, the rest of the program is for the public to speak. It's not an interactive back and forth or Q&A session. It's just for each of you who are on the speakers list to speak and share your opinions and any facts. In order to have all 25 or so of you have an opportunity to speak this evening, we limit the time to 5 minutes, which gives you a nice opportunity to make your points. To help you manage your 5 minutes, there's a timer, an electronic timer right here on the dais. When a person comes up and begins speaking, the light will be green. It will be green for 3 minutes. When you have 2 minutes left in your speaking, it will turn yellow. When it turns red, that means your time has expired. When it starts to blink in about 10 seconds, I'll ask you to finish your sentence, and then just any piece of paper that you want to hand in today or tomorrow to the board office will be taken and considered by the full board. So if you can't get all the words in this evening, you are welcome to submit anything in writing for consideration to finish it up. let's see. I'm going to call each speaker by their name and with the affiliation that they provided at registration. I will also give a heads up about who is, to use a bit of a sports reference, the on-deck speaker, so that you can move closer to one of the microphones and be ready to speak when you are called for the next time. I apologize in advance if I mispronounce any names. I will do my best. Please correct me when you come up and speak if I have mispronounced your name. We want to know what your name is the way you want it said. And that's it for the rules of the road. They're pretty simple. Let's get started with our first speaker. That is Joe Itier, the Community Advisory Board Chairperson for New York City Health and Hospitals, NCB.
Good afternoon, everyone. Thank you for being here today. My name is Joe Itier. I'm the chair of the North Central Bronx Community Advisory Board. It's an honor to share with you some of the work that we as a CAB have done this year to better serve the Bronx community. As a community advisory board, we represent the diverse voices, needs, and concerns of the neighborhoods surrounding North Central Bronx Hospital. Our role is to listen, advocate, and collaborate because we understand that a healthy community depends on more than just medical care. It depends on trust, equity, and accessibility, principles that guide everything we do. We take this responsibility seriously, and we are committed to ensuring that everyone in our community has access to the care and resources they need. This year, we continue to focus on direct community engagement. Our participation in local health fairs and outreach events has been a cornerstone of our work. These efforts allow us to connect with residents, provide important health information, and offer resources that help them take control of their health. By being present in the community, we're able to build trust and meet people where they are, which is critical for improving health outcomes. One of the highlights of our year was our joint legislative breakfast in February. This event allowed us to bring together local leaders, healthcare professionals, and community members to discuss key issues impacting healthcare in the Bronx. It was an important opportunity to advocate for policies that ensure our community's healthcare needs are met and underscored the power of collaboration between the hospital, community members, and local leaders. We also work closely with the Care Experience Team, an initiative focused on enhancing patient care and supporting our youngest patients through various activities such as reading to children in the pediatric department, donating toys and blankets, and even creating buttons with our staff. We've been able to contribute to making our hospital a place where both children and their families feel cared for and supported. These small acts of kindness create a positive environment for patients and staff alike, and we are grateful for the opportunity to be a part of that. This year also marks a very special milestone for North Central Bronx Hospital as we celebrate the upcoming 50th anniversary of the hospital. We reflect on the incredible progress we've made over the years. From our humble beginnings, NCB has continued to grow, not only in the services we offer, but in the number of patients we serve and dedicated staff who make it all possible. We've evolved into a cornerstone of healthcare in the Bronx, providing vital care to our community, and this anniversary is a testament to the hard work and commitment that everyone, staff, patients, and the community has put into making NCB what it is today. We're excited to kick off the 50th anniversary celebrations at the annual Back to School Fair, where we will not only celebrate the hospital's legacy, but also look ahead to the future. Like Jacoby, North Central Bronx has faced its own set of challenges this year, including leadership transitions and the loss of key staff members. But through it all, the resilience of our community has been evident. We've come together, worked through the challenges, and remain focused on our mission to ensure that every resident has access to quality care in the environment that fosters trust and compassion. As we look forward, NCB is committed to continue to build on the work we started. We will strengthen our partnerships, expand our outreach efforts, and continue advocating for policies that make healthcare accessible to all. With the ongoing support of the community and our CAB, we will work to create a healthier, more equitable Bronx. Thank you for your continued support. Together, we can continue to make a positive and lasting impact on the health and well-being of our community. Thank you very much.
Thanks very much for your comments. The next speaker is Charmaine Graham, a Community Advisory Board member for New York City Health and Hospitals Jacoby, and after that will be Anna Melendez.
Good evening, everyone. My name is Charmaine Graham. Welcome to all of you. I serve as the Secretary of Jacoby Community Advisory Board. It's an honor to be here with you all to reflect on the work we have done over the past year and the incredible impact our community has had on Jacoby's effort. At Jacoby, we believe that healthcare goes beyond the walls of the hospital. Over the past year, we have actively involved in several health fair and community outreach events throughout the Bronx. These initiatives have allowed us to connect with the community members, offer health screening, and provide vital resources and preventative care. Healthy living, by being out in the community, we are able to directly address the health needs of our neighbors and ensure they have informed and support their needs to make informed decisions about their health. Our CAB members play an instrumental role in these efforts, and I want to take a moment to recognize the unique and invaluable contribution they made. Many of our CAB members are professionals in the field of education, research, and social work. They bring their expertise, passion for service to our board, which allow us to approach our work from a multifaceted perspective. Their professional experience in these areas not only enhance our outreach and engagement efforts, but also ensure that we are providing the highest quality of support to our community. Whether it's through advocacy, resource development of direct services, these individuals are helping shape the future of healthcare in the Bronx. One of the standout moments for Jacoby this year was our legislative breakfast in February in partnership with North Central Bronx Community Advisory Board. This event allows us to bring together local leaders, healthcare professionals, and community members to discuss the pressing healthcare issues facing our community. It served as an important platform for advocacy to ensure that our voices are heard by lawmakers and that healthcare needs of the Bronx are addressed. This year has also been a time of significant change for Jacoby, with leadership transition and ongoing construction aimed at improving our hospital's infrastructure. We have faced some challenges, but through it all, our CAB and staff has shown resilience and unwavering dedication to our mission. We have continued to provide excellent care to our patients and support to our community, all while adapting the changing landscape of healthcare. As we move forward, Jacoby remains committed to deepening the connection with the Bronx community. We will continue to prioritize outreach, collaboration, and community engagement with ensuring that we adapt to the evolving needs of our residents. With the continued support of our CAB members, staff, and community partners, we are excited for the future and to continue grow in Jacoby. Thank you all for your ongoing support. Together, we will continue to make Jacoby a place where we care and compassion and commitment for the community. Thank you once again.
Thank you. The next speaker is Anna Melendez, a Community Advisory Board member from New York City Health and Hospitals Lincoln, and after that is Suno's Sunny Sarouche.
Hi, good evening, members of the board and distinguished guests. My name is Anna Melendez. I'm a member of the Lincoln Community Advisory Board. I am representing our CAB chair, Richard Izquierdo, who sends his regrets that he could not be here today. Thank you for the opportunity to provide an update about the great work happening at Lincoln Hospital. I want to take this opportunity to thank the members of our Community Advisory Board for the work that they do to advocate for Lincoln Hospital. I also want to thank our CEO, Cristina Contreras, and the hospital administration for the great work, for the great partnership between our CAB and hospital leadership. The C-suite team attends our meetings every month and keeps us updated about the great things happening at Lincoln, and also actively seeks our feedback about the views and needs of the community in order to improve services. Our CAB members work collaboratively with the hospital's administration and serves as their eyes and ears in the community. I know that many of the CAB members use Lincoln for their healthcare needs, and therefore, they are able to give the administration, or we are able to give the administration, real-time feedback, which helps them to improve the services provided by the hospital. Lincoln continues to be a great community resource. We strive to not only be a place where the community comes when they are sick, but also a great neighbor and partner for community needs. I want to give you a few highlights of some recent community outreach events. In February, Lincoln hosted an employment, health, and resource fair connecting community residents with valuable resources and support services. Over 400 people attended and 25 job offers were made. In April, Lincoln hosted an Easter egg hunt. Over 400 children from our local schools attended. Also in April, Lincoln hosted a town hall meeting which was open to patients and staff. Several patients attended and provided valuable feedback. We also continue to work with our elected officials so that we get our fair share of funding to support patient care and our capital needs. Earlier this year, the CAB hosted our legislative forum, and we had a great response from our elected officials in the Bronx. Most of them attended or sent a representative. Working together, the CAB and the hospital leadership looks forward to an even better year of many more accomplishments as we continue to work to make Lincoln the hospital of choice for the South Bronx community. Thank you.
Comments? Thank you. The next speaker is Sunoz Sunny Soroush, a private citizen, and after that is Ronald Polanco.
Hello. My name is Sunny Sarush, and I'm a midwife at North Central Bronx Hospital. I'm here to speak today because despite putting myself through graduate school to become a nurse midwife for 3 long years while working as a registered nurse during a pandemic and going into significant student loan debt to do so, I make less money now at NCB with 3 years of midwife experience than I did as a registered nurse. I took a $20,000 pay cut yearly from my previous job at a different HHC hospital in NYC in Manhattan, where I had the exact same midwife role. The same job, the same population, $20,000 less. Same organization, just a different hospital. I've been paid more at other NYC hospitals as well, even with less experience than I have now. You may ask why I decided to work here when the pay is so low. I don't know if you have ever met an NCB or Jacoby midwife, but in the famous words of Kendrick Lamar, they're not like us. This is one of the strongest and longest standing midwifery programs in New York City for a reason. People travel for Queens for us for a reason, Dr. Katz. We are an amazing team and we deserve to be paid what we're worth. We provide amazing patient care and we are essential to the OBGYN care at NCB. We provide most of the care on the labor floor. We do all the prenatal visits, pretty much. We provide the majority of the care. We do everything that is asked of us and needed of us to serve the patients, even if we're not paid. We stay late, we come early, we skip lunch, we skip dinner, we skip breakfast, we skip bathroom breaks, and we do it because we care and we're needed in emergency situations and because labor is never on a clock. But most of us, including me, have to work session or overtime or second jobs in order to survive. At this time, I work a minimum of 52 hours a week because my pay is too low at my full-time midwife job at NCB. This is extremely difficult because our job has a heavy and physical and emotional toll. We are the only place in the hospital where people expect to leave with a happy outcome, and although most of the time there is one, even if we do everything right in our care, there can be bad outcomes without explanation. We give our whole selves to our patients, emotionally and physically. I love my job and my NCB midwife team, but I'm exhausted. My schedule is grueling. I work nights, days, 24-hour shifts, and it's only getting harder in this economy to make ends meet. We, the NCB and Jacoby midwives, deserve to be paid equally to our midwife counterparts all across New York City, and we deserve to be able to pay off our school debts and survive and feed our families by just having one job. Frankly, you guys at HHC are insulting us with your current pay offer, and although we do not want to, we have authorized a strike 44-1 with a 98% vote yes. The last thing we want to do is leave our patients without our care. It is actually breaking my heart that I have to do this. We feel that a strike is our only option for us to achieve justice. We are only asking to be fair. I'm sorry. I'm sorry. We are only asking to be paid what is fair, and it should not take 3 years for us to get a fair contract. You keep saying Pagny, 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 but you guys are a big part of this too, so please step up. Please show us that you value us and that you care about us and you respect our work and the care that we provide and the patients that come to NYC, HHC, NCB, and Jacoby for us. Thank you, everyone here, for your support, and please give us a fair contract.
The next speaker is Ronald Colangelo, Vice President of Mothers Against 1900 Seminole, and the speaker after that is Roxanne Winston.
I guess you remember me from last year. I'm Bob Nolan's friend. And you said there's no retributions or actions taken against you when you speak. An individual sitting in this room, when I went to the following Jacoby CAM meeting, stood up, berated me, belittled me, screamed at me, and refused to let me speak. And he's sitting in the room here. Wonder if he'll stand up and raise his hand. Guess not. So, after I didn't take the bait by causing a scene, having me dragged out by security and banned from all the Jacoby meetings, his co-conspirator went over, gave him a little back rub, and said, we'll get him. So, this individual tried to get Christy Marmorato on the CAB board, full well knowing that she was running for city council. But that got brushed under because, you know, he could say what he wants. Oh. And then when we told them she was running for city council, this individual said, oh, that's next year, which was an out-and-out lie. But since he's one of the boys, he could say what he wants. Since he tried to get me dragged out by security, I guess this fellow isn't going to raise his hand about doing that at the meeting. See, he's getting a little red, I can see from here. So, as you just mentioned about, you know, the Fortune Society, we had a little rally over here in July. The mayor was coming to give you $50 million. He didn't come. All the airport computers went down, so we never made it. Another individual sitting in here came up to me and said, how about I tell you there won't be any sex offenders at 1900? I laughed at him. I said, you guys already signed a piece of paper with the Fortune Society, so you have no control over who comes and who goes. Started off sick and dying guys from Rikers. Oh, be sympathetic. You have this board, they have a board for the jails. They told the Fortune Society there weren't enough people. That's when it became pre-trial detainees. They don't have to come, sign in anything. They'll come and go as they please. They haven't been convicted of anything. They're still free citizens. Now, I know I don't look like I know people, but I had friends, and there was a judge around here that would tell people, have the anticipation of incarceration. So for 3 months, they pull off every little crime they could in the neighborhood. So when they were inside, they didn't have to call their mother up for money for cigarettes or candy or whatever. So these pretrial detainees are pretty much the same thing. They'll be roaming around, doing what they got to do. And if you notice, there's been an uptick of local crime. I don't even know which buildings you own. Building 1 now, Einstein, Montefiore. It's a psychiatric clinic. Okay, so now we have people with mental issues roaming around. Are they the reason for an uptick? Can't say, can't know. Little kid got banged out up the block on Pelham Parkway. Where did these individuals come from? Why is there a spike in little crimes here, little crimes there, break-ins, cars, this and that? We don't know, but that building number 1 is open with psychiatric patients. Are there inpatients? They come in, say hello, goodbye. Are they on medication? Are they taking their medication? Could this be the reason there's assaults going on? I don't know. So Kenny Centers, Montefiore, Einstein, getting rid of 1900 supposedly to a group of people that are trying this. This isn't something they've done before. So this is all new to them with these pretrial detainees. And as you can see, I'm the only one here. You squash the neighborhood, neighborhood association. Oh, yeah, they're here a couple of times. Now they're gone. Why is that? I don't know. So what can you say? That you guys are just looking to be landlords now. Are you a hospital or are you landlords? Montefiore here, Montefiore there, Just Homes over here. So what you're doing is you're leasing out real estate. The thing in 1900, you signed a 100-year lease for a project that hasn't even been approved by the city council. Now to try to get rid of it, you already have paperwork signed. So what do we do now? Oh, well, we just signed it just in case it happens. I'm trying to get a STEM school put in there over there with Sheikh Musta. We had a little rally over here. Of course, the people in there, oh, well, you don't want to get involved with that. Right? We'd rather have a bunch of convicts or supposedly new convicts or possibly innocent people roaming around. But you don't know and I don't know. And why would somebody come up to me and say, we'll try to make sure there's no sex offenders?
Okay,
Why would
I'm
you
going to
say
ask
that
you
to
to
me?
complete your remarks now because your time
Okay,
expired.
I'm
We'll
done.
take it all in writing.
I'm
Okay,
done, just so you hear me. And I'll be
Thank you.
back. I'll
Thank
be
you.
at Lincoln Hospital like the last time.
Thanks for your comments. Next speaker is Roxanne Winston, a midwife at New York City Health and Hospitals. And after that is Mary Sampino.
Okay, good afternoon. My name is Roxanne Winston, and I'm a midwife here at Jacobi Medical Center.
Thank you.
My words to the board tonight will be brief because, frankly, I am exhausted. Not just because I'm coming to speak with you all post-call after working overnight last night and now functioning on just a few hours of sleep, but the physical exhaustion only pales in comparison to the mental and emotional exhaustion of showing up day in, day out, working for an employer who does not value, acknowledge you, and in turn places you and the patients that we care so deeply about at risk. We have been working under an expired contract for over 3 years. To put that into context, what has happened in the past 3 years? In that time, the midwives at Jacobi and NCB have caught over 5,400 babies. Because we catch over 90% of the vaginal births at both of our institutions. We have performed over 1,500 circumcisions. Many of us don't like doing it, but we do it because that's what our patients want and that's what's asked of us. Because we do almost all of the newborn circumcisions within our facilities. We have assessed, triaged, admitted, and assuaged the concerns of pregnant patients and their families because we exclusively staff the OB emergency department. So when someone comes in with leaking of fluid, vaginal bleeding, concerns that their baby's not moving well enough, we are the people that see them, that care for them, and then hopefully bring them to a beautiful delivery or the best possible outcome for that family. We delivered over 60% of the babies at our facilities. All this while being told by PAGNI, the group that H&H hired to hire us, that our work is actually not that important, that the recruitment and retention of our team is not a priority, that they have no power to support us because H&H holds the strings. We care so deeply for the community of the community and the patients that we care for, because many of us identify with being immigrants or the children of immigrants, of learning how to navigate social and public services to receive care, of being English language learners or English as second language individuals, or fighting the stigma of walking into a healthcare system with a Black body, a brown body, an undocumented body, disabled, plus size, marginalized bodies. We hold those same identities as our patients. So we care for these women and birthing people and their families with deep care and compassion, because they are our sisters, our cousins, our mothers, our nibblings. However, we can no longer continue to pour from an empty cup. We have been without a contract for almost 3 years. We are struggling to retain or hire experienced providers, and our patients suffer for that. We do not have enough staff to cover our labor floor. Last night, we are a service that has 2 midwives on the floor at all times. Last night, due to our short staffing, I was the only experienced midwife on overnight. This is unacceptable and unsafe. Unacceptable for us as the staff and for our patients that H&H purports to care about. Unsafe, exactly. H&H, you do have the power. Bring PAGNI to the table for a fair contract. That's right. We have already voted 44-1, as my coworker said earlier, 98% to go on strike. We do not want to go on strike, but please believe we will do whatever is necessary to keep ourselves and our patients safe. And with that, I just ask that you put the pressure on PAGNI, because our communities deserve a strong midwifery service. And if you don't stand for us now, this service that has been here for over 40 years is going to be gutted, and you are going to sorely regret it. Thank you.
Your comments. The next speaker is Mary Sampino, also a midwife and midwifery site coordinator at Jacoby. And after that will be Heather Lieberman.
Hi, I'm Mary Stampino. I've been working at Jacoby since 1990. I've had the honor and the privilege of being a part of this midwifery staff and working with this amazing group of providers, of midwives, who are dedicated to these patients 24/7, 365 days a week. They show up. They show up. They give their all. But we need you to show up. I wrote some things down, but I'm just at this point going to just speak off the cuff, because really what the 2 things that I want you to hear tonight is, 1, you do things that make no sense, and 2, y'all need to show up.
That's right.
Okay? It's been years and years of the midwives being treated like they are the lowest priority in this organization. Mm-hmm. And it just makes no sense. When it's time to negotiate, you keep talking about PAGNI, but PAGNI shows up and says, we don't have money. We don't have income. We have to get it from H&H. H&H isn't your employer. They don't have to come here. And so it's just this shell game, it's like a big joke to you. And this is their this is their life. This is a huge service that was a groundbreaking service 40 years ago. I've been part of it for the last 35 years. But we have, we were the first with a really significant collaborative practice with doctors, working within the system, trying to provide the best care for these women within the system. But it shouldn't always have to be a fight for us. So what's really brought us to, I was also the president of the bargaining unit for 10 years. What's really brought this to a head now is we are having such a hard time to hire and to maintain staff. And we've gotten so low that you are now paying physicians to cover midwifery shifts. I'm gonna say that again. You are paying physician overtime pay to cover midwifery shifts because we do not have enough midwives, okay? We had midwives turning us down last year, new grad midwives, because of the work conditions and the pay, that they can get so much better elsewhere. And that is a shame. And now we have the last 2 midwives that we hired burned out and left in a year. So even after we replaced 2, we lost another 2. Shame. We've got 8 midwives who are in our 60s just at Jacoby. Social Security eligible, okay? We're gonna start retiring in the next few years. How are you gonna hire 8 people in that amount of time? And who's gonna be there to train the new people? You really need to focus on this now. This is like, it's time. And you can't, enough with the game that PAGNI says they don't have the money and they get it from you. And you don't show up. You show up for the docs. You've shown up before when it comes down to it. You need to show up.
Show up for us.
Thank you. Thanks for the comments. Next speaker is Heather Lieberman, a midwife, and after that is Adrielle L. Dyson, O2.
I'm not Heather, but I'm a midwife, Megan. I'm going to take her time because she's not here. I'm also signed up to speak, and I'm working tonight at HHC at NCB as a midwife. So I'm going to try to do this so I can get to work. So good evening. My name is Meg. I'm a midwife at North Central Bronx. Midwifery is a profession that's often seen as selfless. Some describe midwifery as a calling, which, if you know, is code for a job that you don't get paid enough for, that will burn you out and make your life terrible. Yes, we do get to help life into this world. And yes, that comes along with sleepless nights, getting screamed at, thrown up on, bled on, pooped on, all while selflessly running towards this instead of away from it. But today, I am not here to be selfless. You might even think what I'm saying today is selfish, but I'm here to be loud and take HHC and PAGNI to task. Jacoby and North Central Bronx midwives, as you've heard 1,000 times, have been without a contract. This means that we have not gotten a raise, a cost of living increase, the ability to obtain additional continuing education support. We have not had success in advocating for additional time during office visits for patients with high-risk conditions or language barriers. This means that you are hemorrhaging staff. You are hemorrhaging midwives who can no longer afford to wait around for these negotiations to go somewhere. We midwives are patient. Do you need time for a baby to descend before we start to push? I'm gonna wait. Do you need time for me to give you a second to gather yourself before I touch your vagina to do a speculum exam? I will wait. But do I have 2 to 3 years to wait for you to get me a contract? No, I do not. I have no patience left, and that is why a strike is what we've come to. Dr. Katz, I want to remind you of the principles of eye care. I just watched the video on YouTube that you made on this, so I know that you know it. Integrity, compassion, accountability, respect, and excellence. These are the values that I uphold as an HHC midwives and the values that HHC executive leadership claims to model. I ask health and hospitals to act like their midwives matter, to look at my humanity with compassion and to be accountable for your actions and not hide behind PAGNI anymore. I hear you say you care, and I want to believe you, but I can't believe you until you show me. Come to the bargaining table with PAGNI and give the midwives who hold these 2 hospitals' birthing units together a fair contract now. And off I go to work to keep your hospital running. Thank you.
Your comments. Next speaker is Adrielle L. Dyson, O2, and after that is Sean Petty.
Good evening, all. My name is Adrielle, and I'm also a midwife at North Central Bronx Hospital and Jacoby Network. As you can see, this is very important to us. And we've tried to play the silent game. We've tried to cooperate, right? Be nice midwives, because we are always supposed to be nice. But as my other midwives have said, the time is now. I want to speak on the fact that midwifery is not something you do because you didn't get to med school. All of us could have gone to med school. All of us are very educated, smart. We have doctoral prepared midwives that work within HHC, and they're getting paid less than a new grad that graduated from my alma mater, UB, last week. Some of these nurses, bachelor's prepared nurses, are coming out of school this summer, and they're going to be making the same money or more than us, than those that have doctoral prepared programs. People have loans that are still not paid yet. Some people come into HHC, to be honest, to get some of the loan benefits that you get from working at an underserved community. But as you heard, that's not why we're here. Some of us have been here for 30 years, 20 years. I came here as a baby nurse, 21 years, fresh new grad, and I'm still here 14 years later. And many of the newer midwives that have come on, they didn't come here to work for a few months to get experience and leave. They came here to stay for the community. And we want you to help us stay because it's been very, very difficult. As you said, people are traveling across the boroughs to come here. They see something. They see something. Do you see us? As we've been negotiating, if we can call it that, because I don't call it negotiating. From the beginning of the contract 3 years ago when we started, we have gone through almost 9 negotiators. Imagine going to a job interview 9 times before you get told, we are working on deciding if we want to hire you. How would that make you feel? I believe you're all sitting up there because you are happy with what you are being compensated for. That's why you show up. We are showing up even though we are not happy. And that speaks a lot of who we are and why we work at this place. In these negotiations alone, we have been asked to define who we are. I'll say about what, 6 times? Can you imagine? You start a contract negotiations. You tell them what is your job description. The fact that the people that say they are our employers do not know what our job description is, I don't have words for it. How can you hire somebody that you don't know what they do? And each time we have had to explain ourselves, explain that we are not NPs, explain that we are not PAs. We are midwives. We have been with women and with all kinds of people and how they identify themselves for many, many years. We want to stay midwives. We want to be the heart. We want to make sure that people are safe. You know, the US is known for being a big country, right? Everybody wants to come to America. But when it comes to healthcare, the US is not doing so good. But the fact is, there is fact that wherever there are midwives, there are better outcomes. That is a fact. So maybe you're thinking, fine, they leave, we'll get some PAs. Fine, they leave, we'll get some other people. But the studies have shown, especially within the Black and brown community, that midwives help and contribute to better outcomes. So if HHC want to have good PR and not be on the news every day for bad outcomes, please help us stay. Come to the table, negotiate with us, because we want to stay. We want to be here. Thank you.
Next speaker is Sean Petty, an RN with NISNA and the local bargaining unit president at Jacoby. And after that is Nicolette Gresset.
Thanks, guys. So my name is Sean Petty. I've been a nurse here at our pediatric trauma center for the last 17 years. And, you know, first met Dr. Katz 6 years ago, 7 years ago. He came to a NISNA meeting, had some very ambitious plans. And to be honest, you know, after years of pretty dysfunctional and corrupt and leadership that did not know how to run this system, the words I used at that time was I was cautiously optimistic about our new leadership here. I can say now that I'm no longer optimistic and I'm no longer cautious. Because we have had to fight for such basic things over the last several years as N95 masks during a global pandemic. We have had to fight for basic things like not making $20,000 less than our counterparts in the private sector, not draining our hospital system. We went from having close to 10,000 nurses to having less than 7,000 nurses in just a few years' time. And you can't blame that all on COVID. We worked through COVID next to nurses who are making 3 times the amount that H&H nurses were making during that pandemic. And we had to fight to save this system. We had to fight tooth and nail the amount of hours that we came, you know, after work, after we're exhausted, working understaffed for years to fight for this contract. And when we won, what happened in the next year and a half? 3,600, as Dr. Katz said earlier, 3,600 nurses were hired in that last year. We, once again, helped save this hospital system. And so why, when this hospital system is under attack like it never has been before, because of Medicaid cuts, because our patients, especially our immigrant patients, are under attack like they haven't been in quite some time, the people that are in a position to fight and to save this system once again, why are we being targeted? Why are we the ones being attacked and scapegoated for the problems that exist in this system? We should be the ones who are valued. In a sane society, when you have a situation where the disparity between outcomes of Black humans and white humans when they give birth and the children that they give birth to, when the disparity is a national healthcare crisis, according to the CDC and the WHO, and the program that is one of the best programs in this country for taking care of those patients, the midwives at NCB and Jacobi, are being treated in this manner. How do those two things square up? How do those two things square up? Just like you were bleeding the nurses for those years, how we went from almost 10,000 to this, that's what's been happening to the midwives in this last 3 years. And nobody here wants it. We don't come to work for the pay. We come to work because it's a job that we can feed our families on most of the time, and we give a crap about our patients. Any number of us who have been here for more than a couple years could have jumped ship for more money at any time. At any time. We get offers every day. On my text, you know, or streaming with offers. We could have jumped ship during COVID and, you know, paid for a second home. But we didn't. We're here to stay. We're here to fight. But you know what? That means we're going to fight for what we care about. And what we care about is this place. We care about the patients more than anybody else. And so that's what we're going to stay and fight for. And we're going to fight to the finish. There is going to be no half measures. Glad to hear that somebody decided that we can negotiate with you guys about this policy, or that there's the 9th now person at PAGNI that's going to negotiate with the midwives. Those are words. We don't need words. We need actions. We need deeds. We need fairness. We need justice. We need respect. And we need to be able to work in an environment that for once values the effort that we put in and the sacrifices that we have made to take care of the patients that desperately need us.
Okay.
We
Would
answer
you
that
please
call.
conclude your remarks?
will.
We're at the end.
We answer that call every day. And because we answer that call, we are invested and we will fight to the end to make sure that investment is worth it.
Thank you. Thank you. Next speaker is Nicolette Gresset, also a midwife. And after that, Megan Fent, but I think that's who
Yeah,
spoke
she already
earlier.
spoke.
Okay. So after that will be Marissa Pofferman.
So I'm actually Kanikia Reed. I believe it was number 15 in line. Nicolette Gressa is not coming, but I also am going to hopefully take her spot as I'm working at Jacoby right now for this night shift that I'm 19 minutes late for. My name is Kanikia Reed, and I'm a midwife at Jacoby. In case you've forgotten, we are employed directly by your subcontractor, Pagny. But HHC is ultimately the parent company or the ones who can single-handedly ensure that this contract is ratified in the near future. I repeat, I am a midwife. I have a Bachelor of Science in Nursing degree. I have my master's in midwifery, which means I am an advanced practice nurse. And some of my colleagues have doctoral degrees as well. And I practice at nearly the fullest scope of practice that a midwife can, a much broader scope than any other NYC midwife. Since we've had to explain who we are and what we do to our own employer, Pagny, over 8 times during negotiations, let's do it here a 9th time. We are licensed independent providers, and as such, participate in healthcare payment plans like Medicaid, conduct approximately 90% of all vaginal births, exclusively staff our L&D emergency room, conduct almost 100% of entry to prenatal care visits, work in a clinic that operates under an HHC standard template that books patients or panels daily at 105 to 127%. Despite our departmental policy of never turning a pregnant patient away, despite how late they are, despite their circumstance, and our very low no-show rate. So this means I'm always overbooked, always overworked, never eating lunch, and always seeing every single patient that walks through the door. We initiated the mother-baby practice, which increases the postpartum visit rate from approximately, or which increased the postpartum visit show rate from approximately 40% to 75%. We initiated the midwifery-led ultrasound unit to accommodate the overflow from our maternal fetal medicine ultrasound unit. We provide options care, first assist with cesarean sections, and we even perform almost all of the newborn circumcisions. When entering this career, I knew that part of coming into this work was meant to be about healing some of the generational trauma experienced by our communities and medical spaces, and hoping to create new narratives of empowerment, voice, agency for the next generation of birth people in the Bronx. But what it feels like is further demoralization, especially in the setting of my intersectionality. I'm a woman, I'm of color, and now I'm a midwife. This makes me ask, why haven't you all ensured the swift ratification of our contract like most other specialties? Is it because we care for primarily women and birthing people? Is it because we care for the individuals most at risk for disparities in maternal morbidity and mortality? Is it because we are one of the most diverse midwifery groups in the country, with 35% of our midwives being Black or brown? Is it because you don't care about the safety of the clients we care for? Or is it because you simply do not value the work that we do? Because all of these reasons would usually drive the funder of our employer to bargain in good faith. We want a fair contract now. What does fair mean? A contract that reflects the integral role we play, a contract that compensates us for the work that we do, a contract that promotes retention of experienced midwives for the safety of the women most at risk, a contract that doesn't expect us to do more with much less. Since our words were not enough, we voted, and 98% are in favor of striking. So perhaps our actions will speak louder. Just as a kind reminder, HHC's women's health NPs, they only work outpatient. Our OBGYN PAs, they don't operate in our scope. We've actually even put out a call for additional help for coverage, and the only people that considered covering were the MDs. So you are then paying them 3 times the amount of what you pay us. And even after that one shift was covered, that specific physician out of his mouth said, yeah, I don't know that I'd be covering that much more. I don't think I'm going to volunteer for that role again. We no longer accept risking safe experience, and quality care for our patients under the strain of understaffing and lack of retention of experienced midwives. The midwives no longer accept the exploitation. The ball is now in your court. Go back to your subcontractor, Pagny, and support them so they can negotiate in good faith.
Thanks for your comments. Next speaker is Marissa Poverman, also a midwife. And after that is Tanaya Graves. Marissa Poverman? Not here.
She unfortunately had to leave. She came with her baby and wanted to speak on the fact that she had considered coming to receive care with us here at Jacoby when she was pregnant and her pregnancy became more complicated. But because of the fact that we are not able to retain and keep our high quality staff because our contract has been not ratified for over 3 years, that the care we are giving can't be consistent. And so she did want me to mention that. And I think that's something for us to think about. How can we retain our staff so that the people who are here giving care can also receive care and feel like this is a safe place to get care?
Thank you. Okay. The next speaker is Tanaya Graves, an RN at Jacoby. And after that is Ronald Day. Sorry, are you Tanaya Graves? No. No. Tanaya Graves? Okay. Tanaya Graves, not here. Okay. Then the next speaker is Ronald Day. He's the Vice President of Programs and Research at the Fortune Society. And after that is Mariano Laboy.
Good evening, everyone. My name is Ronald Day. I'm a Senior Vice President at the Fortune Society and just come here to share a few words about the Just Home project. So Just Home, in partnership with H&H, will create 83 units, permanent housing. 58 of the units are supportive studio units and 24 are affordable studio units, accessible through New York City's Housing Connect for New Yorkers who will qualify by income, with preference for local community members of Community Board 11. The preference is going to be for seniors who live in the community and who are unable to afford an apartment that is smaller. And what we intend to do, as we've done in our other permanent supportive housing program in West Harlem on 140th Street and Riverside Drive, is we made a commitment to be a good neighbor. And in being a good neighbor, what we did in West Harlem is that we have the community board meets there. We have a food giveaway on a regular basis once a week. A lot of elderly community board members line up very early to get the quality produce and other items that we provide. We have a lot of other activities. We do a block party every single year where we give out a lot of stuff to the community. So our commitment, which we've always said to this initiative, is to be a good neighbor. We know that there are some concerns that have been expressed by community board members. What we've said is that we invite any person who lives in this community who wants to come to Fortune's West Harlem Castle Gardens building, we're more than happy to give a tour to people so that they can see the building, so that they can speak to individuals and see the type of housing that Fortune has provided for individuals who are going to be living in this particular project. This one is for people who are coming home from Rikers who have complex medical needs and do not have any place else that they can go where they would have permanent supportive housing like we're going to have at this particular place here. And I just want to just mention that my colleague Charles Yellowday is here. He's a resident of this particular district, has been here living in this community for over 10 years, is one of our transitional coordinators and works with individuals who are currently incarcerated and are going to be receiving services similar to those who are going to be coming to this housing initiative. So we're very excited for this particular project, and happy to be in partnership with H&H as well as HPD to ensure that individuals who have had some touch point with the criminal legal system can have quality, safe, and affordable permanent housing. So thank you for the partnership with H&H. We appreciate it. And if there are any questions, more than happy to answer them, to provide a card so that people can be in touch with us and understand more about the project as we move along. So thank you. Appreciate it.
Thank you very much. Thanks for your comments. We're not going to take questions this evening. Nope, not to the group. So the next speaker is Mariano Laboy, a cab member at Morrisania, and after that is Sharon Peter.
Thank you.
Thank you.
Mr. Katz, Mr. Pagan, board members, my name is Mariano Lavoy, Community Advisory Board of Morrisania. Welcome to the mainland, Bronx County. Last year, I came to you praising you on the decision for asking for assistance in regard to Morrisania and your delivery. Thank you. Our community is very grateful. Last year, I stated that you, Mr. Katz, and you, Mr. Pagan, have been the best president and chair of the New York Health and Hospital I ever had. Today, I stand for that and confirm once again. Thank you. My only grievance is that your decision to build a housing complex in Mauritania, your decision was totally wrong. You will hear from me for years to come. What would you provide Mauritania? Very adult primary care, pediatric, women's health, behavioral health, on-site 340 pharmacy, dental care, pediatric, eye care, radiology, and nutrition. Last year, I asked you for assistance in dental care, you delivery, eye care, you delivery, radiology, you delivery. Mauritania is in need of new dental chairs, 3D scanner, and we just stated having installed. Thank you. Dental restoration equipment, new dental imaging, and recession modernization. That's our part to lobby on your behalf to obtain the necessary funding to obtain all of this. One of the issues that I spoke to you last year was, and thank you for this brochure, what you need to know about colon cancer. Colon cancer is very risky, and the most affected are Blacks and Hispanic. And do you know that almost 90% of the residents of the Bronx are Black and Hispanic? Only 8% are white, 3% are Asian. One of the controversies that you said I'm going to talk about is diversity, equity, and inclusion. DI is totally wrong. It's racist, it's discriminatory. Once again, it's wrong. One of the prime examples that I'm going to give you is the University of Los Angeles was number 4 worldwide before 2020. Now it's about 17, because in 2020, they start only hiring minority people, gay or whatever. There's nothing wrong with that. But they went the wrong direction. One of the issues that we have to do is we as a Bronx side, we have to get involved in vote. Ladies and gentlemen, you know that only 8% of the residents of the Bronx vote. That is wrong. We have to get more involved. And I want to be a little controversial. I disagree with one of the previous speakers. You are sitting there because you earned it. Thank you, Mariano Lavoy from Community Advisory Board of Morrisania. Thank you.
Thanks so much for your comments. The next speaker is Sharon Peter, head nurse at Jacoby, and after that is Richard Izquierdo.
Good evening. My name is Sharon Peter. I'm the head nurse on 3A surgery in Jacoby Medical Center. I want to take a moment to talk about the recent changes, or rather the new interpretation of our hospital sick call policy. To be honest, it feels deeply unfair, and more than that, it feels like a step backwards in how we treat the very people this hospital depends on most, its nurses. Nurses have the right to be sick. That shouldn't even be a debate. We work long hours, often skipping meals, pushing through fatigue, and exposing ourselves to illnesses because our job is to care for others. But in doing so, we cannot forget that we are people too. We get sick, we burn out, and when we do, we deserve the ability to rest and recover without fear of punishment. I want to share something personal. A few months ago, I came in sick, really sick for 2 weeks straight. I kept showing up because I was afraid that if I called out, it would reflect poorly on me, that I'd be labeled unreliable or worse, face disciplinary action. I was also concerned for my unit. We worked chronically short-staffed, and I worried I would burn out my fellow nurses. I worked while coughing, lightheaded, and utterly exhausted. And you know what? That wasn't safe for me, for my coworkers, or for patients. But fear overruled common sense because the policy created an environment where being sick feels like a failure. And I know I'm not alone in that experience. COVID-19 exposed the cracks in our healthcare systems. It showed us just how unprepared organizations were for a large-scale health crisis and how essential it is to retain experienced nurses. We struggled to staff units, we scrambled to keep up with the demand, and we saw nurses leave the profession altogether. One of the biggest takeaways should have been this: our systems must support and protect the people who care for everyone else. Changing the interpretation of the sick call policy now sends the wrong message. It tells new nurses that they are expected to work through illness. It tells seasoned nurses that their years of loyalty and sacrifice can be met with scrutiny instead of compassion. It erodes trust. If we want to recruit and retain strong, capable, committed nurses, we need to start by treating them like people, not just as labor. That means giving grace when someone is unwell, creating a culture where health is prioritized, and ensuring our policies reflect care, not control. We all want to be dependable. We all want to be here for our patients, but we also deserve to be part of a system that respects our health, our limits, and our well-being. Let's not forget, caring for caregivers is just as critical as caring for patients. Because at the end of the day, a healthcare system that does not care for its caregivers is one that will collapse under its own weight. Thank you.
Thanks for your comments. The next speaker is Richard Izquierdo, the cab chair at Lincoln. Is he here? Okay. The speaker after that is Miriam, speaker for now, Miriam Zinstein, also an RN, and after that, Nancy Chen, an RN at Bellevue. Miriam Zinstein.
Hi, my name is Miriam Zinstein. I'm a behavioral health nurse, inpatient at North Central Bronx Hospital. Very proud to work for NCB, NCB strong, representing care. And I'm here to talk about the sick time. Also about the mental health crisis that we have in this country that we so ably, sorry. Okay. So we know that New York City is facing a mental health crisis, and New York City Health and Hospital is on the front lines of dealing with that crisis that we're facing. And also we are seeing a decrease in the number of inpatient beds that are available. Inpatient hospital beds matter because we have patients who unfortunately are not able to or don't want to receive the community care that they need so desperately, and we provide compassionate care for them that they need. But they're not only receiving behavioral health care needs in our behavioral health units. You may see them in any unit. You may see them on the street. They may be in your family. Mental health issues don't discriminate. They face people from all walks of life. And we need to recognize that. It's very stressful for us at times, even though we love what we do. I love being a behavioral health nurse. But we need to know that New York City Health and Hospital is going to respect our sick time when we need it, because we're coming to work sick, to be perfectly honest with you. As part of the largest municipal healthcare system, New York City Health and Hospital provides about 60% of all behavioral health services for children and adults in New York City. That's amazing. We need to provide mental health services for our nurses as well. And one of the mental health services that we need to provide is being comfortable calling out sick. If we can't call out sick, we can't take care of ourselves and we can't pour from an empty cup. But we want to be there for our patients. Also, it's going to lead to nurses leaving our system, and we don't want that. Protecting nurses' ability to use their sick time as they've been using it for the past 37 years is a big step in reaffirming New York City Health and Hospitals' commitment to safely caring for our patients, the communities we serve, and the frontline healthcare providers, our nurses who care for our patients day and night. Thank you.
Thank you. Next speaker is Nancy Chen, an RN from Bellevue, and after that is Ray Briggs.
Hi, good evening. My name is Nancy Chen. Good evening, the staff, the directors. I hope you all have a good evening today because we're here to voice our opinions about the sick calls. Again, we're back here with the same topic, same complaints. It has not changed. We've been out to how many of these meetings? You talk about, oh, we're going to discuss it, Still, nothing has changed. I just want to share with you what happened to me when I was sick, okay? I came in one day, all right? Now, my ADN, and if you don't know what that means, that's Assistant Director of Nursing, okay? Everyone knows what that is, right? He saw me from a distance. I had pink eye. Now, what do you do when you have a nurse with pink eye? The first thing you think of, well, send them to employee health. They can't stay here. It's contagious. It's infectious. No, what did they say to me? He said to me, hey, Nancy, you got medicine? I said, yeah. I nodded my head. He goes, well, that's good. That's good. And you know what else he said? Put on a lot. Put on a lot. Oh, that's good. Now, this is an ADN who we all have taken infectious control courses to renew our license. Common sense would say, hey, that's not safe practice. Am I right or wrong? It's not. Unsafe, totally. Okay, and this is what goes on. It happened with me. And when it happened, there actually was another witness. A head nurse was sitting there and said nothing. Okay, and this is the absolute truth. It happened to me. I can voice it. They can't deny it. It happened. So what do you say to that? You have nothing to say? I mean, come on. This is infectious. This is not what we want to pass on to our patients. Does that make any sense? This happens, it just happened to me, but I'm sure it happens at all of the other hospitals in different forms and different ways. So what are we going to do? Keep coming back here and talking about, oh, we're still discussing it, but nothing's happening. So what are you going to do about this? Tell us, oh, we're in negotiation with DC 37 and NISNA, but so far, nothing. So can you give me an answer? This is management. I'm not lying. They were there. I heard it. Okay? What else can we do now? Do you have an answer for me? Does anyone have an answer here? Well, you know, I'm not going to stay here longer. I just want you guys to think about this. This is serious. It's not a joke. And the new nurses that we did hire, they're not sticking around because when they heard about the sick policy, they were like all disgusted and saying, hey, I've never heard of such a thing. This doesn't happen at other private institutes. This is the first time I've heard of such a thing. I mean, you wasted a lot of money and time, you know, with orientation with these new employees. Guess what? They're not sticking around. Okay? So I hope you guys can come up with a decent solution very quickly. Okay, thank you very much.
Next speaker is Ray Briggs, an RN with South Brooklyn Health.
Welcome, panel. My name is Ray Briggs. I'm from South Brooklyn Health, LB President. Welcome, all of you from Jacoby. Dr. Cott is still my friend. I really and truly like your leadership. I know we've beaten up on you, but I was told in the military by the soldiers under me, you have to bitch to me, and then I bitch to the commander. And there's as simple as it is. That's your position, Dr. Katz. We have to bitch on you, and then you go bitch to the higher powers. And I know you will do a good job. I have that faith and confidence in you that you will see the nursing policy as being something that can build H&H instead of destroying H&H. Because I've seen your vision, and what I see for you is that you recognize that you're dealing with minority nurses. You always talk about the immigrant population, and you know fully well that in H&H we have overwhelmingly minority people working in H&H. And as nurses of the minority status, we feel disenfranchised about this sick leave policy being thrust upon us, as well as we feel that we are the least stakeholders in guiding the future of H&H. And that causes some kind of dissension in the camp. But as I said before, I pray for you and I trust that you will guide us in the right direction. Going forward, I would like to let you know that we do 12-hour shifts, especially bedside nurses, and within that 12-hour shifts, there is, since the last contract, there's a lot of interventions that have been added in our job descriptions, more than ever before. And we are seeing more patients, more ill patients, and patients are becoming more and more dependable on H&H. And if you see the figures, you will see the astonishing figures that each H&H facility is handling on a daily basis. That is why it's imperative to keep this policy in place. It's not the punitive measures in terms of saying that you're going to punish the nurses. For some nurses who may take advantage of it, yes, we can correct that. There's a lot of ways we can correct it. But in terms of removing it, it will serve to the detriment of H&H, because a lot of H&H nurses are about to leave. We are about that age where we're about to leave, and the new nurses don't have any retention the feelings towards H&H. I told the ED a lot of times, and I see the nurses, and they're saying, after 2 years, I'm gone. After 3 years, I'm gone. Our next contract is still next, maybe 2027. And we hope by that time we could come up with more lucrative retention policies to keep our nurses. Or if not, it will cost us more. I don't want to take much of your time because I know you're tired, Dr. Katz. You know, you work endlessly. You really, really work endlessly. I know for sure. But I just wanted, this is about the issue brief, New York City Health and Cooperation, where it says here that May 11, 2023, H&H has transmitted citywide testing and immunization response to its hospital and clinics. New variants of the COVID virus continue to evolve, and hospitalization endure, but not at the same level earlier. H&H reported inpatient and outpatient visits have returned to pre-pandemic levels. Yes, but at the same time, that's good news. We're doing good work with your vision. But at the same time, what we have seen was that H&H had a situation where they had been incurring tremendous amount of cost as a result of hiring agency nurses during COVID. Tremendous amount of costs, and it's costing us a whole lot of money. So I come back to retention and saying to us that we must try to address this sick leave policy from the perspective of retention for our nurses. this one here is New York Health and Hospital Nurse Staffing Trends Update. It says here that facility nursing vacancy rates vary widely from 3.3% to 18.1%. However, these rates may reflect the services provided by facility and not just the desirability of working in these facilities or other factors. What
Mr.
it's
Riggs,
saying
will you
is that
conclude your remarks?
the retention rate has to do with the workload. Also, it has to do with other factors affecting the staff. And just one more quote. It says the report includes a trend analysis of nurses nationwide in New York City and in the rest of the state and in the rest of the state and companies and the rest of the states and compares it with progress at H&H. Appropriate staffing levels will be critical for ensuring H&H can continue to deliver quality health care services for all New Yorkers, helping to bring in and retain patients and enhance its revenue mix to achieve its financial targets needed to maintain budgetary balances. So again,
Thank you,
everything
Mr.
deal
Briggs.
with the nurses. So please, Dr. Katz, from the budgetary perspective, let us retain our nurses as well. Thank you.
Thank you. Our last speaker for the evening is Sonia Lawrence. She is the president of the H&H and Mayoral Executive Council for NISNA.
H&H, we do great work, don't we? Dr. Katz, H&H leadership, esteemed board members that are present and all present here. My name is Sonia Lawrence, the president of H&H Mayoral Executive Council with the New York State Nurses Association. I have served as a nurse at Lincoln Hospital for 29.5 years. I stand before you this evening not just as a nurse, but as the voice of my colleagues who are being silenced by fear and intimidation. We are the heartbeat of New York City health and hospitals, the ones who show up when the world shuts down. Through Ebola, RSV, monkeypox, avian flu, measles, to name a few. We have been on the front lines, exposed daily to deadly infections. We have always delivered, creating illusions that we can do anything, even with nothing. And now we are being asked to sacrifice our very health and well-being. The recent attempts to change our sick leave policies are a betrayal. Nurses are being counseled at an alarming rate for using their earned sick time, not just for themselves, but for their families as well. This policy is being applied unfairly, arbitrarily, and punitively. As a result, nurses are being pressured to work while being sick. And when nurses, the very frontline caregivers of healthcare, work sick, our patients get sick. We saw this play out in the COVID pandemic. This is bad for nurses' health. This is bad for public health. It erodes morale and endangers the very system we have worked so hard to build. Our public and safety net hospitals are in the fight of our lives. The federal government is poised to slash Medicaid, and we are being asked to fight each other over our sick time. This is not the fight we should be having. We are not just nurses. We are the unwavering pulse of this institution and the ones standing between life and death, who holds the hands of the frightened, who offer solace to those that face despair. We are the embodiment of compassion, resilience, and dedication. But even the strongest among us need support. Even the most dedicated needs protection. Even the most compassionate needs care. We are not asking for special treatment. We are asking for fairness, and we are asking for not for privilege. We are asking for respect. We are not asking for charity. We are asking for justice. The actions for punishing us for using our earned sick time is not just unfair, it is dangerous. It jeopardizes our health, our patients' well-being, and the very foundation of our healthcare system. We are here today to demand change. We are here to demand a policy that honors our commitment, our sacrifice, and our humanity. We are here to demand a policy that reflects the values we uphold every day. We are not expendable. We are not invisible. We are the heart and the soul of this institution, and we will not be silenced. We will continue to fight to protect our health, our families, and our patients and the communities in which we serve, because safe staffing saves lives. Thank you.
Concludes our program for this evening. Thank you so much for coming, for sharing your views, and get home safely. Thank you.
Thank you.